Hello everyone, thank you for joining me today for our Heartbreaker webinar for women. My name is Cyrus, I'm owner and formulator for Pure Lab Vitamins here in Ottawa. During this webinar you can ask questions in the Q&A section on your screen. Please keep in mind though, I will answer many of your early questions throughout the presentation. Linda from our team will monitor your questions in the background, leaving the big ones for me to answer live after the presentation. I always enjoy the Q&A session at the end, so please stay tuned for that. Okay, let's get cracking. Today's topics. First, I'd like to detail what is the cardiovascular system and what diseases it can develop. We'll discuss the risk factors, especially for women, explain the relationship between lifestyle, diet, stress and cardiovascular disease, and then talk about natural treatment options with dosage recommendations. So what is the cardiovascular system? A simple question with a complex answer. The cardiovascular system is comprised of the heart, all the blood vessels, including the fine capillaries, and all the blood. And some would argue that the lungs are part of the cardiovascular system as well, because this is where the gas exchange happens. Oxygen in and carbon dioxide out. But the function of this system is not just to transport gases. It also transports nutrients from the gastrointestinal tract into all tissues. It transfers waste from all tissues to the liver for metabolization and then into the excretion pathways like kidneys, gallbladder, and also sweat, breath, hair, and nails. And finally, the cardiovascular system delivers hormones from where they are made to where they are needed. Cardiovascular disease, or CVD, is a class of diseases that involve sclerosis or plaque formation of the arteries. And if the arteries supplying the heart, the so-called coronaries, have plaque, or if they are starting to get blocked, this would increase the risk of angina or a so-called myocardial infarction, which is a heart attack. If the arteries leading up to the brain, so-called carotid or vertebral arteries, are plaqued up or blocked, the risk of dementia or a stroke goes up. And if the arteries in the periphery are affected, we're dealing with general atherosclerosis. So here we have an image showing a somewhat healthy artery and a sclerotic one. And you see how the plaque prevents proper blood flow. The flow is reduced. More important, if ever a bigger particle comes along, an embolus or a floating clot, you can see it would probably get blocked by the plaque, leading into an instant stop of flow. Now it depends where this blockage is located to experience the variety of outcomes. If it's inside the heart muscle, you'll have a heart attack. If it's inside the brain, you'll have a stroke. And if it's in your leg, you'll experience a so-called thromboembolism. And none of these are any fun. Other conditions in this class of cardiovascular disease are arrhythmia, where the heartbeat is either too slow, erratic, or too fast. And there's a congenital heart disease, which is already present at birth. And heart failure and heart muscle disease, so-called cardiomyopathy. So now we're coming closer to what brought all of you here as women. Heart attacks strike differently in women versus men. While men typically suffer this specific chest pain radiating into the left arm, women suffer far more subtle symptoms that are often ignored or misdiagnosed until it's too late. In women, we often see stomach pain as a symptom of a heart attack, which is then likely treated with an antacid, like those nasty PPI drugs. Pain occurs in the arms, as in men, but also in the back, the neck, or even the jaw. Shortness of breath is equally present in men and women. The same with nausea and lightheadedness as a symptom of heart attack. But sweating in women is often mistaken for a hot flash and ignored. And this is why women are 16% more likely to die after a heart attack compared to men. Their symptoms are lesser known connected to other issues or quite often ignored by those women. They might say, "Oh, I don't have time for this now." In Canada, heart disease and stroke are still the #1 cause of premature death in women. Also interesting, just to give you a better understanding, 5 times more women die of heart disease compared to breast cancer. But only 1/3 of all heart disease research focuses on women. All this data and statements come from the Heart Research Institute and the Heart and Stroke Foundation, Canada. So when it comes to risk factors for cardiovascular disease in women, there are 5 factors that apply equally to women and men. #1 is diabetes. It practically turns the blood into ketchup, thick, if it's not controlled well. And you can imagine that circulation with blood like that is reduced if the viscosity of the blood goes up, gets more sticky. #2 is high blood pressure, and that's the biggest risk factor. With more pressure inside the pipe system, you'll get more deposits, more plaque. We would have the same issue within the pipe system of our houses if we ran the water at higher pressure. #3, high cholesterol levels have been controversial for decades now. Today it's being discussed whether inflammation inside the cardiovascular system is the underlying cause for plaque formation and not high cholesterol levels alone. And this could be an evening-filling topic by itself, and I will go more into it a little bit later. Smoking is a huge risk factor. Nicotine tightens the blood vessels and blood pressure goes up. Many of the toxins from tobacco also increase inflammation. And finally, there's stress, and we're having a whole chapter about stress coming up in a minute. And then there's the women's only section of risk factors affecting only women. One of these factors is menopause, especially when women decide to use synthetic hormone replacement therapy, or HRT. There was a very important study back in 1991 called the Women's Health Initiative, which was investigating the benefits of Premarin-Provera combination drug therapy. This study actually had to get stopped halfway through because it became very obvious that this specific combination of prescription drugs increased the risk of heart disease, stroke, blood clots, even breast cancer and dementia significantly. But even untreated menopause increases the risks indirectly because the hormonal changes during menopause can increase blood pressure, and estrogen withdrawal has a detrimental effect on the cardiovascular function and metabolism as well. As a side note, there is the option of BHRT, or bioidentical hormone replacement therapy, where knowledgeable medical doctors, and meanwhile also naturopathic doctors, measure blood or salivary hormone levels first, determine what is individually needed for proper balance, prescribe bioidentical hormone preparations, which are then usually compounded by a knowledgeable compounding pharmacist. And then also followed up by proper monitoring of hormone blood levels in regular intervals. I have seen many rundown, even gray-looking women turn into radiant, happy persons again over the course of just 2-3 months of BHRT. The next women-only risk factor comes from having been pregnant, and this is often completely overlooked. But there's very clear statistic data from actually a Canadian study published in The Lancet in 2005, where women with pregnancy complications faced an increased risk of premature heart disease. These risk-increasing complications were low baby birth weight, with babies born in the low 10th percentile of the weight range. Placental abruption, where the placenta separates from the uterus before giving birth. Preeclampsia, characterized by very high blood pressure, usually starting during childbirth and usually lasting just 72 hours and up to 6 weeks. And premature delivery in general, and also if women develop gestational diabetes. 5 to 10% of Canadian women are affected by these pregnancy complications. And this concludes the women-only risk factor section. Moving on to the stress chapter, and you see this must be important because it has its own little chapter. In a release from January 2013, the American Medical Association noted that stress is the basic cause of more than 60% of all human illness and disease. Biochemically, stress makes us release stress hormones. Another indicator that this is important, stress even has its own hormones, eh? These hormones are cortisol, epinephrine, and norepinephrine. They are meant to release blood sugar, raise blood pressure, and heart rate to help us deal with crisis and give us a fighting chance to overcome a crisis. From an evolutionary point of view, this helped us as humans survive. For example, a bear attack or something similar. And after the attack, the cavemen and women could go back to chilling by the fire. But today, stress is chronic. And that is the problem we are facing. The relationship between stress, heart disease, and sudden death has been recognized since antiquity. And the incidence of heart attacks and sudden death has been shown to increase significantly following the acute stress of natural disasters like hurricanes or earthquakes or tsunamis. And this slide is quite drastic, showing acute stress increasing the risk of heart disease by 40%, of a heart attack by 25%, and of a stroke by even 50%. That's what acute stress can do. One other thing that needs to be discussed is chronic stress and its effect on our digestion. Chronic stress puts us into a chronic fight or flight mode. The stress hormones epinephrine and norepinephrine regulate where our blood flows, and in a stress situation, blood gets rerouted only to the heart, the lungs, and our skeleton muscles to make sure these organs have the supplies they need to fight or run away from the bear. In this chronic stress situation, there's practically no supplies available to receive, digest, and absorb nutrients because the gastrointestinal tract has been completely cut off from its blood supply. Furthermore, the same stress hormones also suppress the release of calming neurotransmitters, especially serotonin, dopamine, and GABA. And these three are also quite important for proper digestion. In consequence, if we are dealing with a chronic stress situation, this will obviously cause indigestion and also malabsorption, which means we are not able to benefit properly, even if we provide ourselves with good foods, organic, local, and seasonal. Chronic stress can, over time, lead to deficiencies, especially in regards to minerals and B vitamins. So you might say, what can I do about stress? It's not that I'm choosing to be stressed, and you're right, but there actually are quite a few measures that can help reduce stress or better change our ability to handle stress. Most of us go through life or through a stressful day, heads down, just trying to cope. Oh, it's going to pass. We breathe shallow, we stop reflecting, we are in a reactive state. But if you raise your head and look at what or who is causing your stress, you can identify your stressors and become proactive. You need to acknowledge them and look the stressor straight into the eye. And then remove those stressors you can remove and alter your attitude towards those you cannot remove. A job that stresses you out day after day is not worth keeping. A partner or friend that stresses you out day after day is not worth keeping either. We only have one life, so you might as well try to enjoy it, right? Exercise is the second best remedy to improve your ability to cope with stress. And with exercise, I do not mean your scheduled aquascience class on Friday afternoon, or your leisure stroll while walking your dog around the block. You have to find ways to bring your heart rate up and engage your whole body muscle pump. Stress happens daily, so exercise needs to happen daily too. Exercise releases endorphins, and these are feel-good hormones that reduce pain, improve sleep, which all reduce stress. Exercise activates the muscle pump, which is crucial to help peripheral tissues flush their waste out. It would otherwise just sit in those tissues and fester. And this is why couch potatoes get all these aches, inflammations, and pains in their extremities, joints, tendons, and ligaments. Good news is you don't have to go to the CrossFit gym every day. Studies suggest that a 10-minute brisk walk can just be as effective as a 45-minute workout, as long as you bring your heart rate up and maybe work up a bit of a sweat. Do something daily. So if you're considering supplements, magnesium is the first one to talk about. Studies have shown magnesium deficiency contributes to all heart health problems, including high blood pressure and arrhythmia. Magnesium is calming and relaxing and regulates our nervous system, helps with sleep and stress. It prevents anxiety, nervousness, restlessness, and irritability. Then there's L-glycine, an amino acid which has shown clear relaxing, anti-atherosclerotic, and anti-inflammatory effects. So why not put these two together into one molecule of magnesium glycinate, which also has highest known bioavailability compared to other magnesium salts. Magnesium is so successful because so many people experience the benefits within just 1 or 2 days of starting magnesium glycinate, because 80% of the population is deficient. And if you'd apply a bell curve onto this 80% number, it shows that about 17% of that number are mildly deficient, about 66% of that number are moderately to severely deficient, and at the tail end of the bell curve, another 70% are approaching depletion. And these are the individuals that suffer from all kinds of magnesium deficiency symptoms like constipation, headaches, migraines, spasms, chronic hamstring or AT band issues, and or back pain in combination. The RDA, the recommended daily amount for magnesium, is about 3 of my capsules per day. This is the dose that will cover your daily requirements. But if you are starting out deficient or even depleted, then 3 caps a day is not enough to provide the RDA and replenish deeper tissues. So for anybody who's just starting to use magnesium for the first time, I'd suggest to use more magnesium initially. Luckily, our bodies have a perfect safety valve for too much magnesium. If you get too much or you have used it for too long, you will notice looser and looser bowel movements, which is when you should cut back to regular label dose. Always spread out your daily total over the course of the day. Once replenishment has been achieved, after achieving the safety valve or activating the safety valve, with concerns about cardiovascular disease, I would finish your magnesium glycinate bottle at the RDA dose, just 3 caps a day, and then switch over to MTQ as your cardio maintenance product. And here's why. MTQ stands for magnesium taurine CoQ10. We already covered magnesium, so we'll now discuss L-taurine and CoQ10. Taurine is an amino acid that naturally occurs within our human bodies. It has very beneficial effects on insulin and insulin receptors, on obesity, muscle health, energy, sleep, brain function, and also on stress. If you would dissect the body and look for taurine, you would find highest concentrations inside the heart muscle. So researchers were asking, what is it doing there? And they were able to find that it helps funnel magnesium and potassium deeper into the muscle cells. These 2 minerals are hugely important for cellular health, hydration, electrical stability, and regularity and strength of heart muscle contractions. Taurine practically preloads the muscle cells, and what is good for the heart muscle works just as well for any other muscle in the body. Athletes love MTQ. They take it pre and post workout or competition. CoQ10. In our product, we're using the active form, ubiquinol. is a natural antioxidant made in the body by the same enzyme that makes cholesterol. It helps keep bad cholesterol, LDL, in its less sticky state. CoQ10 supports muscle function, circulatory health, and helps generate energy, and also protects the blood vessel walls, the inner lining of the blood vessels, against radicals, thus reducing inflammation inside the blood vessels. CoQ10 deficiency has been associated with cardiovascular problems including angina, arrhythmia, heart failure, high blood pressure, but also muscle pain. And those individuals that are using cholesterol-lowering drugs, so-called statin drugs, are at particular risk of CoQ10 deficiency because the enzyme that these statin drugs block is also the one producing our own CoQ10. So putting magnesium glycinate, taurine, and ubiquinol into one cardiovascular formula is a no-brainer. And here we have the composition of MTQ per capsule or per day. We see at full dose, 2 caps twice a day, you would get 300 milligrams of magnesium, 1500 milligrams of taurine, and 80 milligrams of active CoQ10 in the ubiquinol form. I usually recommend to take this with breakfast and dinner. Many of our customers still use bedtime magnesium glycinate by itself to help with general relaxation and sleep, if the safety valve allows it. Remember, if you're taking too much magnesium per day, your bowels will tell you. So after replenishment, you have to figure out what is your maintenance dose per day. And your bowel function is the gauge for that. Simple. Next on the list are B-complex vitamins. Stress depletes us of B vitamins, plus our diet truly contains less and less. Furthermore, all B vitamins are water soluble and they flush through us very quickly. And a regular B-complex supplement only works for about 60 to 90 minutes. You can actually see that because about 10 minutes after taking your regular B-complex, your urine turns very brightly yellow, which is the B2 already being excreted. And about 60 to 90 minutes later, your urine is clear again, or almost clear. So Pure Labs Bioactive B-complex contains all the Bs in, first of all, their active form, bioactive, and they're fully therapeutically dosed, but most importantly, it is a slow-release formulation which provides blood levels for 8 to 10 hours. And the proof is in the pea, not the pudding. You take 2 capsules of our B-complex in the morning and you will still pee yellow when you come home at night. Moving on to vitamin D3. D3 has received widespread attention for its potential role in preventing cardiovascular disease and even type 2 diabetes. There have been several studies suggesting that individuals with low levels of vitamin D3 have an increased risk of heart disease, stroke, hypertension, and diabetes. Stress also has an influence on vitamin D. Studies showed that vitamin D blood levels plummeted during times of acute stress. It just vanishes. No? So now the big question is vitamin D3 dosing. Health Canada still recommends 1,000 IUs per day for every Canadian. And I try to compare our supplemental needs to what our body would normally produce if we were to expose ourselves to sunlight. No? There's 2 studies providing somewhat conflicting information. The Oslo study from 2005 investigated vitamin D body production during a 30-minute full body exposure to midday sun. And they were able to show that the average body would produce an equivalent to consuming 10 to 25,000 IU of vitamin D3. They compared blood levels after sun exposure to levels after taking supplements. And then there's the Boston trial, where they tested vitamin D skin production in the winter at noon in Boston, Massachusetts. They distinguished different skin types and concluded it would take about an hour for the average skin type 3 to make 1,000 IU in the winter in Boston at noon. You see, there's no way around testing your own blood levels while using a specific oral dose of vitamin D3 consistently. So all this said, vitamin D3 testing should become part of mainstream medicine to prevent cardiovascular disease and type 2 diabetes for bone density maintenance, for better mood during the winter, and most importantly today, to boost our immune system during this pandemic. For anyone interested in this, please visit our YouTube channel under Pure Lab Vitamins. You'll find a large number of videos, but look for vitamin D optimization and vitamin D and immune defense. We're coming closer to the end, so let's please take all a deep breath and stay awake. Vitamin K is the umbrella name for a large group of vitamins with varying chain length and other molecular features. First, we have to distinguish vitamin K1 and vitamin K2. K1 is best known for its role in blood coagulation. K2 plays an essential role in development and maintenance of our skeletons and bones. K2 comes again in a variety of subtypes, K2 MK4 to MK13. More specifically, vitamin K2 manages calcium deposition into the bone matrix and keeps calcium from depositing into soft tissues, like the blood vessels. In essence, vitamin K2 sends calcium to where it should go. Within this group of vitamin K2s, specifically MK4 and MK7 are being used most commonly. In between those two, it's the MK7 that has longer side chain and shows highest activity in humans and has clearly better bioavailability and longer half-life in the blood compared to MK4. All vitamin Ks interact with the blood thinner warfarin, also known under the brand name Coumadin. All the modern blood thinners like Pradaxa, Xarelto or Eliquis are not affected by vitamin K. Today these more modern blood thinners are much more commonly prescribed because they don't require the blood work or patient's dietary compliance. So Pure Lab's vitamin K2 MK7 is a pure and all trans MK7 at 120 micrograms per VeggieCap. It's soy-free product, which is unique because most K2 products are made from natto, fermented soy. Ours is made from rose and geranium flower oils. It's non-GMO, but the key factor with our K2 MK7 is the double microencapsulation of the raw material. You can imagine K2 MK7 has a very high binding affinity towards calcium and other minerals. So if you're using regular K2 with a meal or with another mineral containing supplements like most bone builders, it will actually bind to calcium already in the gastrointestinal tract, which would prevent absorption. The double microencapsulated form we're using prevents that from happening, which means more of our K2 MK7 can be absorbed into the blood and then do its job with the calcium while in blood circulation. So many people ask me, why don't you combine your K2 MK7 with vitamin D3? And you'd expect me to have an answer to that, right? And I do. We talked about vitamin D optimization, which can lead to higher daily vitamin D3 requirements to achieve blood levels, to meet your needs. But if you were to use a fixed combination product, D and K, you would consume much higher amounts of K2 MK7 as well. And while there are some practitioners who recommend high doses of vitamin K2 or K in specific conditions, for the average Canadian who are consuming good amounts of green leafy vegetables, the 120 microgram per day should be sufficient. Finally, we have to talk about L-theanine, which is the calming ingredient of green tea. An average cup of green tea contains about 8 to 10 milligrams of L-theanine, which means our 250 milligram capsule is equivalent to 25 cups of green tea just with one capsule. Obviously, this capsule does not contain any caffeine or other tea components. L-theanine is an amino acid, and only the pure L form promotes relaxation and is bioactive. There's also no known toxicity and no contraindications with any prescription medication with this supplement. It helps reduce nervousness and restlessness, but also increases focus during times of stress. So it's calming, but it doesn't make you drowsy, the perfect daytime stress supplement. L-theanine inhibits the effects of stress hormones epinephrine and norepinephrine while upregulating serotonin, dopamine, and GABA. So it does exactly the opposite of what stress does to us, and that's why people call it nature's antidote to stress. L-theanine also increases alpha brainwaves, hence our slogan, "Ride good brainwaves." And these alpha brainwaves are only present in an EEG while we are alert and relaxed. And they're also known to boost creativity and reduce depression. Many of us suffer from stress-induced sleep problems. We wake up in the early morning hours and our brain is revving with repetitive thoughts, a so-called busy brain. L-theanine, even though it doesn't make us drowsy during the day, it downregulates our overnight stress levels so we sleep through this early morning rising. There's also a clear synergy for sleep when it's combined with magnesium glycinate at bedtime. And these are the 3 L-theanine products we carry, each one with a specific application. Regular L-theanine 250 per capsule are meant for the average Joe or Joanne with regular stress levels. Joe and Joanne would take 1 capsule when needed, morning, noon, or bedtime. Our 200 milligram slow-release caps are meant for the more chronically stressed individual with more severe anxiety symptoms. And they're meant to be taken on a regular basis to combat stress effects and to keep anxiety levels low. The regime can be adjusted to what you need, for example, 2 or 3 capsules during the day if needed, plus 1 or 2 at bedtime for sleep. And then we have our sugar-free chewables with just 125 milligrams of L-theanine, and they are very fast acting, especially if you keep the chewed slush in your buccal pouch or under your tongue. It will absorb straight through the mouth mucosa, takes only minutes to work. So this could be used for breakthrough anxiousness or real attacks, and also for kids. One customer told me she uses our slow-release L-theanine at bedtime, and if she wakes up, she would chew 1 or 2 tabs, roll over, and go back to sleep with a smile. I found that very nice. So that's it from me. Thank you all for listening. I hope this was of value to you. I would now like to thank our retail partners who have helped bring attention to this webinar, and I will start answering your questions in just a few seconds. Please stay tuned. Obviously, more and more retail partners on this slide. We need to increase our screen size to fit them all in there. It's really nice to see, and nice to see that so many of you take the time to listen in and yeah, spend time with me. So there's already a few questions here. They're coming in. Sue is saying hello from Ottawa. I say hello, Sue from Ottawa. And then I have an interesting question from somebody anonymous. If you have bad cholesterol, how bad is the risk factor for your heart? Well, that's a very controversial topic. Cholesterol has been on our radar since Pfizer brought out Lipitor, the first statin drug on the market, mega selling in the billions year over year, continuously prescribed. But there is growing evidence that cholesterol by itself isn't the only risk factor. Let's say it this way, that actually underlying inflammation inside the cardiovascular system has to be present first, so that then the body uses cells and cholesterol and calcium to kind of put a plaster layer onto this inflamed tissue. And then over time, if the inflammation inside the system doesn't subside, more and more plaque formation gets added onto, like more plaster layers on the inside lining of the cardiovascular system. So many people try controlling cholesterol with diet and exercise, by burning it off, by trying to avoid high cholesterol foods. Keto diet has significant impact on our fat metabolism for triglycerides as well as cholesterol levels. Consuming omega-3 fatty acids can also shift the ratio of HDL, which is the bad cholesterol, towards more LDL. Sorry, the other way around, LDL towards HDL. So there was a trip here. There's also a couple of other things that can be done from a natural point of view. One supplement really sticks out. And sorry, to finish omega-3s, you really also have to use high quality products that contain really strong amounts of active EPA, DHA. There's many products out there that tell you there's 1 gram of fish oil in the capsule, but the actual content of icosapentaenoic acid, oh my God. I'm the one here disturbing myself with my own phone. EPA and DHA are the active ingredients in omega-3, the actual omega-3 fatty acids, and there are some fish oils that contain a lot more of these active ingredients per gram or per volume of oil than others. So look for high quality fish oils. And so the other supplement that I wanted to point out here is, which I actually haven't talked about in this presentation, is NAC, N-acetylcysteine, because there's clear evidence on how it supports the cardiovascular system. We actually have a fantastic blog on our website written by our fantastic Andrea Bartels. It's called Help Your Heart with NAC. She points out in great detail how it is a powerful antioxidant, how it enhances mitochondrial energy production, helps with energy supplies for the heart muscle and the rest of our bodies. It lowers blood pressure and lowers homocysteine. And homocysteine is a blood marker that can be used to measure your body's tendency to be inflamed, especially inside the cardiovascular system. So if you can lower homocysteine levels, you're practically reducing inflammation on the inside of the blood vessels. And with that, even with higher levels of cholesterol, good or bad, you're reducing plaque formation. NAC also improves nitric oxide production, which is our own cardiovascular messenger to relax the blood vessels so that the volume goes up, pressure goes down. And with that, you get also better circulation in the fine capillaries within the organs and finer tissues of the body. And NAC also reduces platelet aggregation. So from that point of view, it would also reduce plaque formation. So there's quite a variety of significant actions. And if you're interested, just check our website, look for the blog section. And it's the first one out on the top of the list right now, called Help Your Heart with NAC by our Andrea Bartels. So I hope that answers your question. It's really a tricky thing. You can't just say, oh, don't use statin drugs if you have like excessive cholesterol levels. But I mean, I'm very sure your doctor would have told you that diet is important to make certain changes. I have seen and heard significant results with keto diets, but those diets are really not doable for everyone, especially not long term. And if it really needs to become your new lifestyle, to become a full-on keto person, because if you're only doing it half-heartedly, you might as well not do it at all. And it's complex, and you'll be craving carbs, and there's carbs in many foods we love. So I think shifting the balance might help from a dietary point of view, consuming less carbs, more greens, reducing the precursor of inflammation, reducing managing calcium better in your cardiovascular system with vitamin K2, MK7, and optimized levels of vitamin D3. These are all factors that would improve your cholesterol levels or reduce the current status of your progression of your plaque formation. I hope that answers that. So you have a question from Heather. Can you speak to how to support someone who is being treated for cardiovascular issues and how they can discuss supplementation with their GP? Good luck with that. Suggested words to use. Not all GPs are receptive to someone wanting to try addressing root causes with more natural approaches. Yeah, this is a problem. I personally don't believe that and there's really only a handful of doctors that are open to this anyway. Secondly, there is not many MDs that take the time to really understand nutrients. So their advice is really not worth seeking. You'll find out very quickly if you bring up these things and your doctor is kind of saying, oh, it's all mumpets, no? Then you might as well save your time discussing this with your doctor. I don't know why you would need that kind of discussion anyways. You're much better off discussing this with a naturopath or nutritionist, and also look at your diet and get suggestions on other lifestyle changes, you know, how you shift your balance around. I think in today's mainstream medicine world, you have to take your health into your own hands. I'm not saying, and never will say, that you should condemn mainstream medicine. I think there's good things in all kinds of treatment fields, therapy fields, but there is nobody really kind of guiding you through this. It's really just you that has to learn and to filter and try and build an understanding of what could be of benefit to you. And you're doing the right thing by being present and learning about these things. And then you still have to make your own decisions. I hope that answers your question, Heather. And Renia is asking, is K2 safe for someone on blood thinners? And what would be a good dose to prevent or help reverse calcification in the arteries? So we talked about this. For the average person, 120 capsules together with a diet loaded in green leafy vegetables and that kind of reduces carbohydrates and reduces red meats to some extent, shifting the balance again. I think a regular 1 or 2 capsules a day is more than enough. There is research that suggests that especially vitamin K2, MK7 can actually slowly degrade calcifications in the cardiovascular system. For that, you might need slightly higher doses. In this setting here, just with me looking at the camera, I cannot give you such dosage recommendations, and I think you should consider discussing this with a naturopath. And then you are guided through a protocol with higher doses K2, MK7, and potentially reap the benefits from that. When it comes back to the first part of your question, if it's safe for someone on blood thinners, there's Coumadin or warfarin on one hand, and you have to be careful with vitamin K while on that drug. But there's then all the other modern drugs like Eliquis, Pradaxa, and one other that I mentioned. And those are completely not affected by K2. So there's no reason not to use K2, MK7 while you are on these modern kinds of blood thinners that do not require INR testing on a regular basis. But even those that use Coumadin could practically use K2, MK7. You should inform your doctor about it. You should use a very consistent dose and then adjust your Coumadin or warfarin dose to that dose instead of doing it the other way around. You will most likely need less warfarin to achieve a specific INR level. But the key factor or the key info here is you can't just, once you start using K2, MK7, while on Coumadin, you have to be extremely consistent, just like you have to be consistent with your spinach consumption, which would also create fluctuations in your INR levels. I hope that explains that. Carolyn says, thank you. Thank you, Carolyn. Judy is asking, the B complex doesn't sit well, or any B complex doesn't sit well in the stomach. Any suggestions? Absolutely. That is a potential, especially since we're using quite potently dosed B complex in our formulation. Use it with food. No? If you're just running out the house and you kind of pop your morning dose of supplements, you might feel like pain sensation and kind of something sitting in your stomach for 20 minutes, half an hour. But usually if you take a B complex with food, you don't feel anything. That's my observation and recommendation. And Marie is asking, can I take L-theanine and melatonin? Would there be any benefit? Melatonin I recommend for those individuals that have very severe or severely affected circadian rhythms, that very interrupted sleep patterns, or very hard problems falling asleep or problems staying asleep. And by using melatonin in a specific dose that you might have to adjust to your personal needs, you're trying to train your inner clock into a more solid, better, longer sleep cycle. For that, you would use melatonin at a specific dose, either 3, 6, 9, sometimes even 12, 15 milligrams per day, per night. And you would use this consistently, even if results are not 100% initially, but by using it on a regular basis. I always compare melatonin to a Chinese gong. And when you take your dose at, like, let's say half an hour before bedtime, it's like you're hitting the gong, and that tells every cell in your body it's bedtime now. And by using melatonin consistently for a month or 2 months, you're trying to more or less educate your circadian rhythm, your inner clock, into a better, longer sleep cycle. Somebody with severe sleep disruptions that only sleeps 2-3 hours a night should not expect a beautiful 8-hour sleep within a couple of months. But if you can manage to bring your sleep cycle from like 2-3 hours interrupted to 4 or 5 hours in one solid piece, I would call that a big success. When it comes to sleep, you have to apply many different things as well, including exercise, not too late at night, daily. There's also many factors that can benefit sleep, and they're kind of listed under the term sleep hygiene, which you can Google, and then kind of follow those recommendations. Personally, I find that it's hugely important to have your bedroom dark, and dark means dark. Any kind of light, you would still kind of get through your closed eyelids. It affects you. I even had the experience that my alarm clock had like a white digital display, and even that light I could feel. And when I turned the alarm clock around, I could feel that how my whole body kind of was able to relax more and better. Hope that helps. Anonymous asks, doesn't L-theanine act on some neurotransmitters? Yes, 5 of them. So wouldn't it have some contraindications with medications that also work on these neurotransmitters? No, it does not. There's no contraindications or interactions with L-theanine. You could be on a triple SSRI cocktail and still use L-theanine without getting anywhere at the risk of developing so-called serotonin syndrome. L-theanine, first of all, downregulates epinephrine and norepinephrine, which are the 2 stress hormones. That will also have an effect on your cortisol levels, which is the 3rd stress hormone. And these 2, epinephrine and norepinephrine, also kind of suppress L-theanine. With any antidepressant drug, you're trying to elevate serotonin levels, and by downregulating epinephrine, you're making these SSRIs practically work better. You're kind of re-establishing proper balance. It works very well, also for people on antidepressants and other psychoactive drugs like Seroquel or Cybrexa and the like. Daniela. How about cholesterol levels which cannot be influenced by proper nutrition but are not genetically driven? Well, in that case, I would, first of all, certainly introduce 2 to 3 grams EPA DHA from omega-3 fish oil, which at least should allow you to shift the balance from LDL to HDL. At the same time, you would want to use anything that helps reduce inflammation in your cardiovascular system. Those are all the antioxidants, vitamin C, vitamin E, CoQ10, You might want to use or consider NAC and acetylcysteine to reduce, as I said before, platelet aggregation. With that, you're reducing plaque formation, and also it itself is a very powerful antioxidant, and it's the precursor for glutathione, which is the body's most potent and most important intracellular antioxidant to also reduce inflammation that way. And then if nothing helps, maybe there is no way around using a low-dose statin drug, but then also make sure that you're getting sufficient CoQ10 as well, so that you're not completely running those blood levels into the ground. It's not really easy. I mean, I wish I had the magic pill that takes care of everything, but it has to really do with lifestyle, good sleep, stress reduction, exercise. You know? Yeah. Dorothy is asking, what is the difference between L-theanine and melatonin? I do not take either, but you cannot sleep through the night. Your mind is always thinking. Well, that's busy brain. That's worry, that's stress. So work on stress, as I discussed in this webinar. Exercise, super crucial. The difference between L-theanine and melatonin is very vast. Melatonin is a hormone produced in the forgot the name of the gland in our brains. We make it ourselves following a circadian. And by using it in supplemental form, you're kind of elevating your own melatonin levels, and you're creating your own circadian rhythm. You're telling your body it's bedtime now, and that really has an impact on not only your ability to sleep, but also on your depth of sleep. L-theanine only has a secondary effect on our sleep by reducing the way we respond to stress. And don't believe that you are stress-free overnight. We all are exposed to stress throughout 24-hour cycles. We just don't notice it as much. But if you're experiencing busy brain, repetitive thoughts, you go in through your to-do list, and when you come to the bottom, you start right back up. You can't let go. That is a stress symptom or a sign of stress. And by using L-theanine at bedtime, you're actually downregulating, as I said before, epinephrine, norepinephrine, and you're upregulating serotonin, dopamine, and GABA. And that kind of allows you to relax and actually drift into sleep and actually stay asleep longer. Give it a try. There's nothing to lose. That's interesting. Anonymous. I've had heart symptoms from long COVID. So far, non-invasive tests are clear, so there's no physical damage or nothing that really sticks out. Is what you prescribe appropriate? Well, I would certainly recommend for you to try the MTQ, the magnesium taurine CoQ10, 2 capsules in the morning, 2 at night. I'm not sure if you are on any medications at this point, but those 3 ingredients do not interfere with any of the prescription drugs. I'm not too sure what kind of heart symptoms you have, so it's hard for me to give you a more appropriate answer here. If you like, just email me at info@purelifevitamins.com and just refer back to the webinar. Just say webinar, heart health webinar, and we could maybe have a more detailed discussion and see what could be done, what should be done. You know? Maybe that's the best. Oh, that's interesting. Julie's asking if I had suggestions for fish oil if someone is allergic to shellfish. First of all, fish oil, most common fish oil comes from fish, not shellfish. There is krill oil, which is another type of omega-3 coming from krill. But fish oil itself shouldn't affect you if you are allergic specifically to shellfish. Might want to give it a try in low dose and see how it goes. But if it's really a shellfish allergy, you should be fine with most fish oil coming from either Atlantic salmon, sardines, and you can actually ask these questions in the stores. There's a handful of very good companies that are very specific and very clean in their product preparations. Donna is asking, I'm aware of the original WHO study linking HRT and breast cancer, but read that the results were discredited due to the very limited number of study participants. Well, that's false. I believe that the number I have in my head was in the thousands. We're talking, and this was a study performed in a variety of countries, and data was merged. I think it was a huge study. I would have to look that up, though. And I'm not aware of a more recent study when it comes to HRT. I know I've been a compounding pharmacist for 25 years. I've prepared hormone creams, capsules, suppositories in various strengths and concentrations and by the kilos, especially transdermal progesterone cream is quite amazing. The key is to actually assess and measure your individual blood levels of progesterone and the 3 estrogens, testosterone. There's a handful more to be tested, and then kind of look at where you are within range and then kind of tweak with as little as possible to get you back into balance. This is bioidentical HRT, not synthetic HRT with Premarin and Provera, which was found to be very detrimental. And the results I've seen time and time again are quite stunning. As I said, there were like gray-looking women handing over their first prescription, and within a couple of months, they were colorful and happy and smiling. Before they were just drained. Again, if you want more detail there, email me at info@purelabvitamins.com. I'm happy to kind of look up whatever I can find. Renia is asking, well, she heard that taurine is good for the brain. Is that correct? Yes. Taurine as an amino acid is very important for energy production. It calms us as well. It's actually an anti-anxiety remedy by itself, even though funny enough, it's in Red Bull, the energy drink, for the energy producing properties. But it's supposed to rev us up and give us wings. But it actually, taurine by itself has very calming and anti-stress properties as well, which from that angle also is good for the brain. Donna is asking whether I made recommendations on vitamin D as a daily dose. Well, I did that in the presentation, and I told you that I can't give you one dose that is good for everyone. There might be individuals that develop like proper mid to upper percentile ranges on just 2,000, 3,000 IUs per day, and others need to use 10,000. The only way to find out is by testing your blood levels while you use a consistent dose, and then make your decision whether you need less or more, depending on your result. In this video that we have on our YouTube channel, Vitamin D Optimization, I explain the process in detail. In brief now, you can't just, you should go and talk to your doctor or naturopath and get not 1, but 3 or 4 requisition forms for vitamin D3. And then you kind of discuss or make a decision what you want to use as your starting vitamin D dose. Could be 2,000, could be 4,000 IUs. Use that dose for 3 weeks to really establish steady state in your blood levels, and then walk to the lab and test your levels. And then you know, with this dose, I am achieving this level in my blood. And you would like to aim for at least be mid-range, which is about 75 millimoles per liter in Canadian lab reports. I say that the reference range most Canadian labs use are actually a statistic distribution of the depleted Canadian population. And I find it's very safe to say that you should aim for not just mid-range, which you normally do with all kind of blood work, but to aim for the upper 75 percentile, which would be around 100 millimoles per liter. And then I also recommend in this video that come spring, when you're starting to expose yourself to sunlight again in short pants and t-shirts and go swimming and do that to some extent unprotected with sunscreens to really allow UV light to penetrate your skin so that you can make vitamin D3 in your skin. You might want to give it a vitamin D break for a couple of months, let's say June, July. I would then use one of the requisition forms to test your baseline summer vitamin D levels to see what your lifestyle produces for you without vitamin D3 supplementation. And you might be surprised what you will find, that with your average lifestyle and the average amount of time spent and skin surface area exposed to sunlight, what your body actually produces as a Canadian with sun protection, clothed and dressed, and with only the few minutes or hours truly exposed to sunlight. So then you have evidence that you might want to use a lower amount of vitamin D3 supplementation throughout the summer so that your levels are not dropping fully down, and you have to kind of then work your way back up to normal or good vitamin D levels come fall when you're starting vitamin D supplementation again. Vitamin D is good for our mood, for our immune system, for our heart health, for our sugar metabolism, all the way through the year, not just from fall till spring. And you wouldn't hurt yourself in maintaining vitamin D blood levels at a certain level all year round. Oh, that's a praise. I was waiting for the question. This is Sue saying, I've changed my health around by changing my diet to a fiber diet, removing processed foods, processed sugar. I'm on all your supplements and I'm feeling so great. Thank you for all your advice. Well, thank you, Sue, from Ottawa, I believe. That's a nice feedback here. This is Daniela, who's asking, what would you recommend for someone taking the classical cocktail of statins, beta blockers, and blood thinners? And she says blood thinners in brackets, baby aspirin. And yeah, for those three drugs, I would recommend to use MTQ twice daily, 2 caps twice daily, breakfast and dinner. I would certainly recommend a B complex. I would consider NAC, N-acetylcysteine, for the blood thinning effect, the antiplatelet aggregation effect, but also for cellular health, glutathione levels, reduction of inflammation inside the cardiovascular system. Vitamin C, vitamin D, which I call staples, which are kind of part of what we call foundation products anyways. A little side on vitamin C here, especially if you're following more modern diets and you're trying to avoid carbohydrates, which normally means you're not only cutting back on potatoes, rice, and corn chips and the like, you might also cut back on fruit and fruit juices, which are very sugary. And those have been, for us North Americans, actually one of the main sources of vitamin C. We humans, we belong to a very small group of mammals that can no longer produce vitamin C ourselves. It's an essential vitamin for us, and we get it 100% from food source, which mostly is citrus fruits and many other fruits. There is C in other vegetables as well. It's not that we're completely lacking it, but if you're cutting back on your fruit consumption, then you might also require more vitamin C as a supplement. I would consider it today as a foundation product as well. Just a regular 1,000 milligram slow release capsule once or twice a day. No downside, only upside. Questions keep coming. Rose is asking whether I consult on personal individual health issues. I do sometimes, and I offer to answer specific emails. Sometimes that kind of leads into a bit of an exchange, but I'm not a practitioner anymore. I hung up my lab coat. I'm no longer a practicing pharmacist, and I don't keep patient files. And for that reason, I can give you advice, and I can maybe direct you towards other disciplines of treatment, but I do not really consult. I have lots of videos out there on many other conditions, YouTube channel and on our own website. And if there's one specific question that you have, info@purelabvitamins.com, just mention the webinar. Heather is saying, I always recommend to ask the pharmacist to make sure they can take it with the medications. Absolutely true. I have to say, though, that my profession, there's good pharmacists and there's a lot of really bad pharmacists that are not in any way knowledgeable about supplements. They might look up the computer and say, yeah, this doesn't interact, but they might not give you the right picture by saying, hey, this might not only not interact with your medication, it might actually help you improve your health or reduce the necessity for this drug, and you might actually be able to cut back on the synthetic prescription drug that you've been using for 2, 3, 5, 10, 15 years. And from my point of view, if you can actually cut a prescription drug in half, you're reducing its impact on your system by 50%. And that is a success. If you can manage to reduce your blood pressure medication with just by adding magnesium on a regular daily basis and monitoring your blood pressure, and once you see that your pressure drops, you can actually then discuss with your physician to cut out, for example, the diuretic, which I would cut out first, because it makes you lose minerals that you're trying to replenish on a regular basis. So there's lots of good pharmacists and lots of bad ones. Oh, hi, Wanda. Wanda, I believe it's the Wanda I know out from Nova Scotia. Regarding MK7 versus MK4, is there any reason to use MK4? Different benefits from MK7. It appears to be more expensive, and it's odd that some companies use it. Any insight? Well, personally, it's very clear that MK7 is the better form for humans. It has longer half-life in our blood. It stays active longer, and if you manage to get it into your body and disallow it from binding to calcium, magnesium, or zinc already in the gastrointestinal tract, then you have a winner. I believe that fixed combinations with D and K or any other bone-building formula with that contain calcium and K are a complete waste of time and money. You really have to use MK7 on its own, and especially in the dry microencapsulated form. There's companies out there that use MK7 in oil base, either soft gels or drops, and they are completely exposed to mineral content in food, as like dairy or minerals from veggie source, and especially they are exposed to bind to minerals already in the gastrointestinal tract if you have a bone building formula that combines calcium with K2. So that's, from my point of view, really, really useless. The double microencapsulation protects the K2 MK7. It allows it to absorb into the blood, and then it can actually bind to calcium and prevent it from forming calcifications within the cardiovascular system, and then actually hand it off to vitamin D3 so it can get incorporated into the bone matrix much more efficiently. So yeah, from my point of view, MK7 is the one to use. It is more expensive than MK4, but with good reason. Is vitamin K2 recommended for someone with osteoporosis? Donna is asking. Absolutely, because it helps manage the flow of calcium to where it's supposed to go. K2, I always compare to the stonemason's assistant. He's the guy that brings the cement over to the stonemason, And vitamin D3 is the stonemason. It then helps the incorporation of the cement into the wall, into the bone matrix. So those two work hand in hand and are certainly indicated. K2 and K7 is certainly indicated for somebody with osteoporosis. Livia is asking, how much NAC should be used for the heart? Can it be used every day or should it be used on and off? What's the max amount per day? It's always recommended to take with food, correct? Any benefits of taking it with food rather than on an empty stomach? No, I would use it with food. It can actually upset your stomach. Can I take NAC with breakfast with all other vitamins? Yes. So the dosing, there's a lot of research out there with sometimes very high doses of NAC. We're talking up to like 3, 4, 5 grams per day. I don't think that is necessary, but I do think that if you've never used NAC before and you're aiming to rebuild your body's reservoirs of glutathione, then you can use higher doses initially to help rebuild your glutathione stores and rebuild your NAC or cysteine reservoir into your system. And then you dose down to regular maintenance dose, and you don't need as much anymore because your cells have it, especially if you combine NAC with selenium. Selenomethionine is a mineral, or selenium is a mineral that helps recycle glutathione. So you have to imagine, glutathione is a tripeptide. It's built out of cysteine from NAC, glycine, which you can get from magnesium glycinate, and glutamine, which is pretty much omnipresent in our diet. Glycine is pretty much is contained a lot as well. But these 3 amino acids pop together, and that is glutathione. And if you don't have selenium in your system, then after the glutathione gets oxidized, it would break down, and we have to start rebuilding it. But if selenium is present, you actually can, like, it technically takes the oxidation away from glutathione, and you have again a reduced glutathione molecule reactivated. So that you can imagine that that is much more efficient than always having to break down oxidized glutathione and then rebuild it in its reduced form again. With selenium present, you can build glutathione with NAC and then recycle it and reuse it over and over and over. So back to the question, how much to use? I would use, as a standard recommendation, in the beginning for about 2-3 weeks, 3 caps a day with food. So that's 1,800 milligrams of NAC. Use at least 1 selenomethionine with that. And then after 3 weeks, you can just go to once a day and maintain, coast on full. Tank is full. Whenever I start, I always veer off. NAC is also actually best known for its ability to reduce the viscosity of mucus, of phlegm. In Germany, in France, it's the best-selling cough expectorant. So whenever you have congestion, in the sinus caves or in the bronchioles and lungs, you can then during those days bump up your NAC again, because it breaks the so-called sulfur bridges in our mucopolysaccharide phlegm molecules. Those are very long molecule chains, and if you have more sulfur bridges in between those chains, then the mucus becomes more viscous, more sticky. And if you break the chains, these molecules can slide along and turn the whole mucus less viscous. So as regular maintenance, after you replenished with NAC, 1 a day is just fine. If you experience any kind of mucus buildup, you can go back up to 3 a day with food. Karen is asking whether there's any test for K2, or whether there's a test for calcification. Well, the test for calcification is ultrasound or an angiogram, and that's not readily handed out. I think you have to look at your family history, whether sclerosis was in your family history or present in your immediate relatives, like parents and uncles, grandparents, and if so, it's fairly likely that you also have a tendency for calcifications. There is no downside to K2 MK7 to be used, especially not at regular 1 caps a day dose. You can increase your green leafy vegetable consumption as much as possible, which also contains organically produced K2. So there's all kinds of potential there, but it's, first of all, there's no risk or danger in using K2 MK7. Oh, there's Dorothy's. Thank you very much. You've described it to me to a T. I will try L-theanine. Good. Let me know how it goes. Rose is asking, does fish oil not lower blood platelets? That would be news to me. But I'm not a fish oil manufacturer. I don't have any fish oil in my product line. Maybe then I would, or I should know at least. It would be news to me though, and I don't really see a connection. To me, fish oils have always been hugely important for proper cellular health because those are specific, very flexible fatty acids that give the cells more fluidity, and with that health, there's better exchange of nutrients and waste happening if the content of omega-3 fatty acids is higher compared to not present. I always compare this to well, if you build a red blood cell or a platelet out of exclusively rigid saturated fatty acids, which are straight molecules, and there's no flex in them, then you can imagine that the cell, which is a sphere built out of fatty acids, also becomes rigid. And that means it can no longer swish through tight spots, the capillaries and so forth. But if you increase the amount of flexible omega-3 fatty acids, which have 3 double bonds in the long side chain of the fatty acid, this fatty acid becomes flexible, and with that, a cell that contains more omega-3s in its lipid membranes becomes fluid, and it can actually swish through any kind of tight spot, especially also the fine capillary systems. So, but again, there might be research that suggests fish oil to have an effect on blood platelets, but I would have to read that up, to be honest, I admit. Have you ever heard of COVID vaccines causing heart palpitations? I have not. Stress and worry can cause heart palpitation. But this I have not heard. There's the whole myocarditis effect and issue with COVID vaccines, mRNA, but palpitations, which is arrhythmia, I have not seen. Stress certainly does that. What is your opinion on plant sterols for lowering cholesterol? Not everything works for everybody. I have seen and talked to people in the pharmacy that had good results with sterols. I think you need to have do a trial, which means you have to use this for 2-3 months consistently, having tested your cholesterol panel, HDL, LDL, and the like, right before, and ideally quickly after you kind of done this trial, 2-3 months later. That's the only way to really find out whether this works for you and your lifestyle. Heather says, thanks for another awesome class. Thank you, Heather. How many do we have left? We're coming closer to the end here. Thank you, Heather. Diane is asking, is there DHEA in NADH with ubiquinol? No. DHEA is an testosterone precursor and has no place in an NADH supplement, which is a vitamin, a bioactive, or I call it super bioactive vitamin B3. DHEA in Canada is prescription only. While I have worked with DHEA numerous times in support of individuals with low testosterone levels, there is none in my NADH product. Yeah, and there shouldn't be. Donna says, thank you. Thank you, Donna. Anonymous is asking, as a person with chronic kidney disease, class 3, which is progressed, but also concerned about heart health, are there any supplements that I should avoid? I would ask that question. I would ask your urologist. You should most certainly not use my AlkaPure, which is the green one here. That has contains of sodium potassium, even though it could be used depending on what your specific situation is. But you would have to monitor your sodium potassium levels more closely. I don't see a problem with magnesium, taurine, and ubiquinol at all, unless you got the recommendation from your urologist that that your kidney function is not dealing well with magnesium levels, which I've never heard of. So using the MTQ 2 caps twice daily would be fine for you. B vitamins are fine for you. Vitamin C, vitamin D are fine for you. NAC is no problem. It's an amino acid, it's not even a protein. So yeah, I mean, what we discussed here today is all good. Anonymous is asking, do vitamins should be taken at different times? Do they interfere with each other's absorption? There's only a handful that do. For example, you should not combine iron with calcium or magnesium. Iron should practically be taken on its own. Then there is certain effects that some of the supplements have. For example, a B complex, if potent, can give you gastrointestinal upset. So for that, you would use that with food. There's certain drugs that interfere with supplements, and they need to be taken care of. Usually you get recommendations from your pharmacist to not use so-called bivalent minerals like calcium, magnesium, and zinc with these specific prescriptions. Those are usually antibiotics, and also birth control can be affected. But other than that, to me, I mean, there is practitioners that always give you very specific and detailed guidance as to what to take when. To me, and I'm a pretty average human, I would not follow a detailed and complicated regime like that. To me, I would fall off the bandwagon and become incompliant. And what these super complicated dosage regimes forget is that if you don't take the supplement, you will have zero bioavailability and zero effect gained. I believe for my life, things have to be simple. I can barely remember a noon dose, or I can remember it, but I oftentimes won't use it. My regime has to be as simple as possible, and I'll still forget it. I'm the worst patient myself. But I think we got to simplify things. And even if it means that you might risk a percentage loss from taking one thing with another, you would lose 100% if you don't take it at all. You know? So you got to kind of weigh weigh it out. Livia says thank you. Thank you, Livia. Wanda says thank you. Judy says thank you. Very informative. Almas is asking, what causes brain shivers? I've never heard of brain shivers. maybe email me at info@purelabvitamins.com and give me a bit more explanation, and we can do that in the next couple of days. Crystal says, thank you. Oh, it's Crystal. Hi, Crystal. I know you. Here we have I believe, a long COVID question or COVID side effect question. What can you recommend for myocarditis? I would suggest NAC, N-acetylcysteine, 3 caps a day, morning, noon, and bedtime. I would use the whole spectrum of antioxidants, vitamin C, vitamin E, vitamin D. I would also consider K2 MK7 for its antioxidative properties. And I would not go into mega doses here, just like nice maintenance doses, like label doses. I would actually also consider seeing a naturopath. There might be applications as well, like looking at turmeric, or also known as, I forgot.
Curcumin?
Curcumin. Thank you, Linda. See, there was a blockage there. And you have to use high quality, emulsified, highly bioavailable products there. We don't make any curcumin. The reason there is that it's very hard to absorb, and only the really high quality kinds will get absorbed. And once you have it absorbed into your bloodstream, you would benefit from anti-inflammatory properties from the curcumin, even inside the coronary arteries and the heart muscle. But I think all this together would be, or should make, a difference. Hope that works. Thank you, thank you. Yeah, I figured so much, Mr. Lahai or Mrs. Lahai, that it came from COVID vaccine, the myocarditis. Daniel says, thank you, thank you, thank you. Oh, Tina, John, and Julie from Well in St. Catharines. Thanks for your time and thanks for listening. And that's it. I came to the end. 44 questions. And we still have good 56 people listening. Thank you all for your time. I hope this was of value to you. Yeah, if there are specific questions, just shoot me an email and I will answer them over the course of the next few days. Have a nice night. Thank you. Bye-bye.